So we just got done watching the Dem debates. One of the big issues that they spent almost the first half of the thing on was Medicare for all, right? That's the thing that they talked about, Medicare for all. So I tweeted out, who out there likes their health insurance? Hashtag Dem debate. I'm going to read you the responses I got, right? They're really pitching private health insurance as if we miss them. We are not stupid. It's a no from me. This is from Blonde Bro. Let me read all these. Bernie asked same time loan more than once. Liz just catching up on her 20. Me, but I'm Canadian. So the Canadian likes their insurance. Where's Tulsi? Nope, just didn't fill 2 prescriptions yesterday because they weren't covered. They were antibiotics and serious cough suppressant. WTF. If my health insurance was a person, I would kill it in self-defense, another person wrote. And there was a response to that. Let's read that. This response is perfect. It took me multiple denials to finally get the amount and type of physical therapy that I needed after spinal surgery. That cost me time. I could have been more productive. It set me back big time. By the way, put the stream out on your social media. Show people what we're discussing. So this is my response to the Medicare for all on thing, right? I have Medicare. I love it. Bernie's Medicare is even better. You won't need to buy a supplement or pay copays, deductibles, or premiums anymore. Plus it pays for dental, long-term care, hearing, and vision. Thank you, Kira Moore. And I want to discuss that right now. Because when they talk about, they're trying to make it like the government's going to tell you what to do. Here's how Medicare works. And correct me if I'm wrong, Kira, since you have it. Here's how Medicare works. If you have Medicare, you can go anywhere. When they're going to try to tell you where to go. Under any insurance plan that you have, anyone, Obamacare, you buy it yourself, or through a job, there's in-network and out-of-network insurance. I know people in like Canada and Australia and Europe are like, what are you talking about? So if you go to a physician that's out-of-network, it costs you more or whatever. If you have Medicare, you can go to any doctor you want, and they pay it. And then what happens, they might say the bill is this much, it's $3,000. Medicare then comes back to the doctor and says, no, it's not $3,000, it's $600. And we'll pay the $600. So first of all, that's why that's the real story. That's why the healthcare industry and the pharmaceutical companies don't like it, because the government will force them to pay less instead of the gouging that they're currently doing. That's what this is really all about. 123 viewing, 63 likes. Hit the like button, hit the like button. So let's go back into this now. They spent a lot of time on this issue, so I want to talk about this. Not me. My state just changed it again. Now I can go to my eye doctor now I can't go to my eye doctor unless I pay cash. None of the dentists in my town except the insurance carriers. Medicare for all would solve these problems. If you're just tuning in, I asked this during the debates on Twitter. Who here likes their insurance? Since all these people like Klobuchar and Buttigieg and Bernie, who are all paid by the insurance industry, nobody brought that up, which was disappointing. I asked who here likes their insurance, because they talk about they're going to kick you off your insurance. I pay my own insurance. It's Obamacare. It's not great. It's cheap, but it's not great at all. And God forbid anything actually happens to me. It's great if you go once a year. I get a checkup. Last year I had bronchitis, so I went there. They gave me a prescription. That was taken care of. Still cost me a little. I had to pay copays. Yeah, I had to pay copays on top of my monthly premium. So, but let's get back to this. Again, I tweeted this out. Nobody. Who here likes their insurance was the question. I think CEOs, the providers do. I loved it when I was in the military. Can't afford it now. Medicare for all. Also, where's Tulsi? See? So Matt Downing had really good insurance when he was in the military. Do you see that? That brings up a bigger issue. There's Medicare for all and free college tuition. How how are we going to get the poor and the working class to join up for our bullshit wars? See, right now we have economic conscription. This is a fancy term for saying poverty draft, right? We haven't had a draft since the 70s. The last time we had a draft is when young people went out in mass. Millions of people went to the streets and said, we're not going to Vietnam. The ruling class saw that and said, well, wait, this won't work. The lowest recruitment for the military was in 2007. The war in Iraq was 3-4 years old. People were like, Afghanistan was 6 years old at that point. People were like, I'm not going over there. I'm not going over there. Oh, weird. A recession hit in 2008. Then I talked to soldier after Marine, after airman, after seaman, all when I would meet them on my tours, especially in 07, 08, and 2011 and 2012, when they said I re-enlisted, I had to. There's no jobs back where I live. I took them. One guy said I took the money. I took it. They would give him like a $20,000 re-enlistment bonus or something like that. That's why he re-enlisted. So I just want to point out, this is part of the ruling class's plan to keep us all down and force us into joining the military, and force us into paying their bullshit costs, to force us into financial servitude. They want us in debt. They want us to have to go fight their wars because there's no jobs in our towns. This is all part of their big plan. And Medicare for all, that's a threat. You don't have to join the military to get good health care. I have government health insurance. I like it. So we're noticing a trend here. If you live in Canada or you were with the military or you have Medicare, then you really like your... So any sort of government healthcare program, those are the only ones people seem to like. No one's saying, I love paying my premiums, my job gives me good health. My what? They don't have it. My what? They don't have it. You know those plans they keep talking about that unions fought hard to get? I have one of those. It's still shit. No wife or kids, and I have a $1,000 deductible. My premiums are $150 a month. Correction, $1,500 deductible. And I hear that story all the time. I used to have, I'm with the SAG, the Screen Actors Guild, SAG-AFTRA. It's the actors union, right? The TV and the film union merged. AFTRA was TV, SAG was union. Just a quick. So the way the union insurance works in show business, you have to make a certain amount of money every year. If you make something like $12,000, $13,000, you get the first level of insurance. If you make $20,000 or $30,000, you get more insurance and stuff like that. And I haven't had union insurance since 2006, maybe 2005. And people that I know, friends of mine that are in the actors union, are like, it's not as good as it used to be. They raised the amount. You don't get as much. Everyone I know who had good insurance says it's not as good as it used to be. I've heard that story over and over again. Ha 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 ha. That's what Denise wrote. I'm fortunate enough to love and afford my health care. Fortunate, Gina. Thank you for being honest. To love and afford. So what Gina's saying, if I understand correctly, she likes her health care. But because she can afford to pay for it. So if you have a lot of money, you get great health care. I enjoy Medicaid very much. So someone who can afford really good insurance is grateful that they can do that. Nope, from Eric Haler. I just avoid the doctor. I'm here for a good time, not a long time. Okay? Let's get some more replies. If we get any more, I don't know. My computer's being a little jankety. So those are the bulk of my replies, folks. That's what everybody said. That's just my little online poll. Nobody, the only person that said they had good health insurance was the person, Gina, who said, because I'm grateful I can afford it. Unbelievable, man. All right, folks, a great way to support 168 watching 98. Hit the like button. Smash the like button, you guys. Oh, man. Go to GrahamElwood.com. Support me at Patreon.com/GrahamElwood. Rockfin.com/GrahamElwood. Like, share, and subscribe.